Good afternoon, and welcome to the July 30th Community Update. I'm Stacy Wood, and I serve as the Public Information Officer here in the Emergency Operations Center in response to COVID-19 in Buncombe County. This community update is available in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. Thank you to all of our partners who make this information available to our Spanish-speaking populations and our deaf and hard of hearing audiences. And we will start with an update from Dr. Jennifer Mullendor, our interim public health director and medical director in Buncombe County.
Good afternoon. Over the past week, Buncombe County has continued to see a sustained increase in the number of new cases of COVID-19 reported in county residents daily. Over the last week, an average of 41 new cases have been reported daily to Buncombe County Public Health, down slightly from an average of 43 new cases reported to us daily during the prior week. As of noon today, there have been 1,560 lab-confirmed cases of COVID-19 in Buncombe County residents. Almost 58% of these cases have been in individuals between the ages of 18 to 49. Sadly, 45 Buncombe County residents have died as a result of their COVID-19 infections. 38 of those individuals were residents of long-term care facilities. One of the important trends we are following to understand the level of spread in our community is the percent of tests that come back positive for COVID-19. In North Carolina as a whole at this time, 8% of COVID-19 tests performed are coming back positive. This percentage for the state has ranged from 7 to 10% over the past month. In Buncombe County, during the month of July, 5% of tests have come back positive for COVID-19, up from 2 and 3% in June. This indicates that we are seeing continued spread of COVID-19 in our community. The takeaway from all the data and trends that we are monitoring, from the number of cases to the percent of tests that are positive, to the percent of emergency department visits for COVID-like illness, is that there is widespread transmission of COVID-19 in the county, the region, and the state. Data is helpful if it informs decision-making and action. And right now, based on this data, we should be acting as if everyone has COVID-19 in our community. Our focus needs to be on stopping that spread and preventing new infections. Please do everything you can to limit your exposure to others outside of your household, and practice the 3 W's when you must be out in public around others. Wear a face covering, wait 6 feet apart from others, and wash your hands often. We encourage individuals to access the information at the North Carolina Department of Health and Human Services dashboard, in addition to our website. It can be found at covid19.ncdhhs.gov/dashboard. If you meet any of the following criteria, we are still recommending that you get tested for COVID-19. If you have symptoms, including fever, chills, cough, shortness of breath, fatigue, muscle or body aches, headache, sore throat, loss of taste or smell, nasal congestion, runny nose, nausea, vomiting, and diarrhea. If you are a close contact to someone with COVID-19, whether or not you have symptoms. If you are a member of a high-risk group and think you have been exposed to COVID-19, again, whether or not you have symptoms. This includes people who live and work in high-risk settings, such as long-term care facilities, homeless shelters, or migrant farm worker camps. People over the age of 65 or those of any age with underlying medical conditions, persons from historically marginalized populations, healthcare workers or first responders, and frontline and essential workers in settings where social distancing is difficult to maintain. Repeat testing is not recommended unless you are an employee in a long-term care facility or have been directed to be retested by a healthcare provider or public health nurse. We encourage you to use the COVID-19 self-checker found at buncombeready.org to assess your symptoms and get connected to testing. Even with our community testing sites currently on pause, COVID-19 testing is widely available in our county through primary care providers, community health centers, urgent cares, hospital systems, and pharmacies. If you do not have health insurance, we encourage you to contact your closest federally qualified health center or one of our local clinics that offers discounted fees or programs that cover the cost of testing and your visit. These would include Mercy Urgent Care, Range Urgent Care, and Mayheck Family Health Center at Biltmore. For more information about testing locations, please visit North Carolina's COVID-19 Find My Testing Place website or call 828-250-5300. Planning and logistics for the Buncombe County community testing sites are underway and moving forward rapidly. We have finalized our contract with a local lab and are hiring additional staff as we speak to fill out a variety of positions and needs associated with our COVID-19 response. If we have uniform compliance with the public health guidance that we've been given, we can reduce the spread of this disease. If that compliance level is in the 90 to 95% range, we can potentially reduce transmission of COVID-19 to negligible levels. If you want businesses to open more fully, if you want to get your kids back in school in person, this is the path forward. We can do it. The number one action that we can all take right now is to prevent COVID from spreading in the first place. You can do this by wearing a face covering, staying at home as much as possible, and not participating in activities that put you and your family at risk. August is National Immunization Awareness Month. Now is the time to make sure that your children are up to date on their immunizations. COVID is not the only infection we should be worried about. Infection rates, or immunization rates, have dropped across the country, and we need to do all we can to turn that around. Please talk to your medical provider or call the Buncombe County Immunization Clinic at 828-250-5096. Thank you, and stay safe.
As a reminder, for those of you who may not have been aware, on Tuesday, Governor Cooper issued Executive Order 153, stopping the sale of alcoholic drinks in restaurants, breweries, wineries, and distilleries at 11 p.m. North Carolina bars that are currently closed will remain closed. This order will take effect tomorrow, Friday, July 31st. We are happy to announce that the new Buncombe County Public Health Director, Stacey Saunders, will be joining us next week. She will be a great addition to our COVID-19 response. And while I have the opportunity, I wanted to say thank you to Dr. Mullendore, who has done an incredible job balancing these two very stressful and important roles in our county as the interim public health director and medical director. Truly, her dedication to public health and the way that she shows up with professionalism and excellence in this field in our COVID response is truly remarkable. In closing, if you must go out in public, please give each other at least 6 feet of space, wear a face covering, and let's make safe choices during this pandemic. Thank you for tuning in today, and we will provide the next community update on Thursday, August 6th at 3 p.m. Thank you.